welcome back. I hope everyone enjoyed their lunch. I know I did. To lead the next session, I would like to introduce to the stage our distinguished guest of ours who came in from Saudi Arabia. His name is Dr. Anas Alsudays. He is the country manager for Remedica, where he leads strategic operations and drives initiatives to enhance pharmaceutical access and healthcare outcomes in Saudi Arabia. He's a tough leader in the pharmaceutical industry, specializes in regulatory leadership, market access, and public health strategies. He holds an executive MBA from Suleiman Al-Ajhi University and a bachelor's in pharmaceutical science from King Saudi University. Please welcome to the stage Dr. Anas. Thank you.
Hello, hi everyone. We're glad today we're starting our sessions for how the public and the private partnership can be drive the healthcare innovations in our markets. For starting these sessions, we will start with our first speaker today, which will be Dr. Shereen Abdalla, which is an expert professional with over than 16 years of experience in sales, marketing, and market access and government affairs in the pharmaceutical industry. She is currently the Director of Communications and Government Affairs at GSK for the Gulf regions, leading the effort to enhance access to innovative medications and vaccines. With a strong background in the health economic, value-based healthcare and policy sharing, she is dedicated to drive the positive change in the healthcare system around the regions. Please join with me to welcome Dr. Shereen Abdalla.
Thank you. Thank you very much, Anas, for the introduction. It's a great pleasure to be here and discuss with you the role of private-public partnership in driving healthcare innovation and enhancing access for better patients' outcome. Before starting my presentation, I would like just to mention that healthcare, it's not just a responsibility of one entity. It's a shared commitment between different entities within the private and government sector. So it's a collaborative effort between health authorities, pharma companies, NGOs, academia. While navigating in the complex healthcare landscape, such kind of collaboration, it's a must. It's not an optional. So during my presentation, I'm gonna explore with you how the partnership impacted the healthcare system positively. I will share a couple of good examples, and at the same time, we are going to discuss how we can advance and strengthen such kind of collaboration to have a bigger impact. So public-private partnership is essential to address the local and the global healthcare challenges. But at the same time, it's very important and crucial to recognize that diseases are not only a health concern. It is considered a significant economic issue for the country. So in order to build a thriving society, healthy individuals can play an important role. So healthy individuals can contribute to the community, to the society, and to the economy. So that's why fostering the collaboration between private and public partnership, it's a critical, to achieve our shared common goal, which is a thriving society. And it's very important to work closely to ensure we are having the right environment that will allow the key players within the healthcare ecosystem are collaborating in an effective and impactful way. So I mentioned that the collaboration will impact the thriving society. But here in this slide, I'm gonna share with you a couple of examples where I believe the public and private collaboration will have a real impact. So for example, we have seen a lot of successful examples of the collaboration were accelerated the research and development, reducing the gap between scientific breakthrough and real-world application. And this has been noticed during the COVID, where successful collaboration between the private, pharma, government resulted with having vaccines that allowed us to combat COVID successfully. Another important collaboration that would create a real impact, which is enhancing the healthcare infrastructure. So in the new modern era, we see how the pharma companies and academia, they partner effectively with the healthcare provider in order to advance the standard of care, but at the same time to support the healthcare provider to establish center of excellence across different disease area, where I believe this will have a great impact on the patient's outcome, but at the same time will contribute to the advancement of the healthcare system in the countries. Another important element, expanding access to medicine and vaccine. So here, it's not only limited to developing collaboratively access solution to ensure that the new innovative treatments, vaccines accessible to all patients, but even there are collaboration at World International Organization like Gavi, WHO, where pharma companies collaborating with such organizations to make such kind of vaccines available in the low-income country. And this is a very good example where we believe that the collaboration have a great impact. A strengthening policy and regulatory framework. So, and I can mention in UAE, for example, there is a great example where UAE government health authorities collaborating with pharma companies in order to introduce innovative therapies to the country. So they are offering a fast-track registration. So this will play a significant role in enhancing the patient's outcome and helping the country's overall goal, which is, building a healthy society. Of course, COVID-19 is one of the most, let's say, defining moments for such kind of collaboration between private and public. During the pandemic, we witnessed unprecedented level of collaboration where resulted with a successful outcome. One of them, as I mentioned, developed vaccine in a record time. So in a 1 year, more than 2 vaccines were available to combat the pandemic. Fast-track regulatory approvals, even beyond the FDA and EMA, and scale up global manufacturing and distribution to ensure that all vaccines available globally at the same time in an equitable approach. So the pandemic demonstrated when we prioritize the partnership, the healthcare solution will be delivered in faster and effective way. So this example should be used as a blueprint when we build our future collaboration to tackle any healthcare challenges. But of course, the value of partnership is not limited to the pandemic or the healthcare crisis. Also, it can create a significant value and impact beyond the pandemic. And here I choose a couple of examples where I believe the collaboration is must in order to address those challenges. One of them, tackling non-communicable diseases. So the chronic diseases like diabetes, cardiovascular, cancer requires a long-term collaboration with the different key players within the healthcare ecosystem. And we see how pharma companies are playing an active role in introducing a new innovative precision medicine in order to advance the cancer care. And such kind of introduction won't be achieved without successful collaboration with the different players. Second part, combating infectious disease. So this is very critical because we need to collaborate with different parties in order to ensure that the vaccines that will prevent diseases will be available in an equitable way. As I mentioned earlier, such kind of collaboration is required even with international societies to make vaccines available in low income, and this won't be achieved without collaboration and partnership. And advancing digital health and AI. AI and digital health transformed the patient care and the healthcare system. And in order to unlock the potential of the AI and digital health collaboration is a must. And there are, successful examples globally and locally where AI is leveraged in a way that will create a significant impact on the patient's outcome. So looking ahead, how can we strengthen such kind of collaboration in order to create bigger impact, to maximize those opportunities? And here I'm going to share with you the strategies that can be adopted in order to have an effective partnership. One, government play a very critical role through developing policies that would incentivize the innovation. Private sector, and here when I say private sector is not limited to the pharma or the private healthcare provider. So they can contribute through developing innovative healthcare solutions and at the same time investing in R&D. Academia and research institution. This is a very important player within the healthcare ecosystem because academia can play a role in reducing the gap or bridging the gap between the scientific and real-world application. And we can see, the growing role of academia within the healthcare ecosystem. And the global health organizations and NGOs. So if we would like to drive equitable healthcare advancement, NGOs play a very important role. So collaboration with those entities, it is required in order to ensure that innovation will reach every patient. So no one will be left behind, and everyone has the right to benefit from this innovation and maximize the health outcomes. So, in my presentation, I tried to demonstrate to you how public-private partnership can drive innovation in the healthcare system and can create a big impact. So in order to address the current and the future challenges, such kind of collaboration, it's a must, it's not an option. And I believe working together, we will be able to build healthier, resilient society that everyone can benefit. Thank you very much.
Thanks, Dr. Shereen, actually, for the amazing, let's say, classified presentations that create a lot of questions, actually, that we need to discuss for these sessions and how we can get more and more understanding benefits for the partnerships as both parties. For that, we need also in the panel discussions, I would like to invite, ladies and gentlemen, it's a pleasure to introduce Dr. Aseel Al-Nassar, as expert in the governmental affairs, regulatory policy, and strategic communications, with over 10 years of experience across both government and the private sector. She is currently the Government Affairs and Communications Director for AbbVie Gulf-Levant, leading the key policy initiatives and stakeholder engagement. Previously, she's held a leadership role at Novo Nordisk and the UAE Ministry of Health, where she played a key role in the pricing regulations and pharmaceutical policy development. Please join with me to welcome Dr. Aseel Al-Nassar. And also, for make the discussions also more and more, we would like to invite also Dr. Sofyan Migdadi, as expert in the pharmaceutical procurement and supply chain management with over 20 years of experience. He leads the pharmaceutical and procurement department at King Abdalla University Hospital in Jordan. Dr. Migdadi is a key figure. Dr. Migdadi, he is a key figure in tendering management, strategic procurement, and healthcare logistics, serving on the multiple national community to enhance pharmaceutical policies and procurement standards. Please join welcoming Dr. Sofyan Migdadi to our panel discussion. Thank you and welcome all for our discussions today. First of all, we appreciate your coming and for this amazing sessions today. I believe it's the right time that we can get more with different experience, different background. So I will start with Dr. Sofyan, actually. We would like to know from you what is the key challenge currently facing in the government and the private sector, partnership with the medical procurement and how we can overcome this from your perspective and experience.
Good afternoon. First of all, just to know, in the supply chain management in general, we are trying to maintain availability of quality assured pharmaceutical products whenever and wherever required at optimal quantity and of course at optimal cost. In order to achieve these two major focal points, the quality and cost, and how to optimize these, we have to fulfill the different 6 rights. These rights are ensuring the availability of the right product in the right quantity, at the right quality, at the right time, and at the right place, and of course, at the right cost. So in order to achieve these goals, there are a lot of challenges they are facing us. The major challenge is that one of these major challenges is fluctuation in demands. The demands is changing from time to time, from season to season, and there are a lot of cases that influence these. So we have to make a continuous and periodic evaluation of different types of stocks that we have at all our institutions, at all stock levels, at all surge levels. In order to achieve this, we have to have a professional and expert health supply chain professionals. This is the main challenge that we are facing, is the fluctuation in demands. The second one is that there are a lot of items, all of a sudden they are stock out, or they will be overstocking. And because of either stock out or overstocking, there will be a very serious complication. Stock out, which means it will affect the quality of care or the quality of service that we are delivering to our patient or to our customers. And at some point, it will be very critical when we are talking about life-saving product. So, by continuous monitoring and periodic evaluation of different types of stocks levels, maintaining them between the maximum and minimum stock levels, we will avoid these complications. On the other hand, the challenge will be is overstocking, and this means there will be a lot of expired, a lot of obsolete drugs, and this will be an added cost. This point will be a very big challenge because our major focal point is to optimize the cost, minimize different types of cost, not only the purchase cost, but we are talking about minimizing the storage cost, the capital cost, and of course the obsolete or the expiry cost. The third challenge is that either the delivery of the defined products in the required quantities, either in the wrong time or on the wrong place. This means we have to define the suppliers. We have to make pre-qualification of the suppliers that we will go to procure these items in the specified quantities. So only standard and reliable suppliers, they are allowed to participate in the procurement cycle. So we are ensuring the delivery of quality assured products at the right time and at the right place in order to achieve our goal, which is optimal cost and optimal quality product. And another challenge is that the cold chain management. And as all of us, you know, that the pharmaceutical products, they are very sensitive products, either for the temperature, humidity, and for different types of conditions. So we have to maintain these conditions according to the manufacturer recommendation during the transportation and during the storage, in order to ensure that this product is effective and safe. Also, in the morning session, one of the main challenges that we have discussed is that limited resources. The resources, all of countries, they are suffering from scarcity of resources. So we have to manage this very professional. In order to overcome this challenge, we have a lot of procedures that could be applied. One of them is the therapeutic group tendering, and this procedure will achieve a lot of cost saving. Also, pooled procurement, also, it's another type of procedure that can be used and can be optimized in order to minimize the different types of cost, which is the purchase cost and the storage cost. Finally, the scarcity of the finished products. And post-pandemic, a lot of lessons that have been learned by different types of institutions. In order to overcome this challenge, we have to diversify the suppliers. We have to procure a lot of items from different suppliers in order to ensure and maintain the availabilities of all items whenever and wherever required. Thank you.
Thanks, Doctor. Actually, it's a comprehensive answer that providing all the way that, which is lead me to the questions to Dr. Shereen, actually, which is, what are the key challenges that in establishing and maintain successful public-private partnership in the healthcare, and how we can addressing this for different aspects or different sides of the company who is looking to cooperate in the market?
Yeah, thank you, Anas, for the question. So my answer would be from a different angle. Dr. Sofyan mentioned very nicely about the challenges associated with the supply chain and the product availability. But for me, first, during my presentation, we highlighted how such kind of collaboration, it's a powerful mechanism to drive innovation, and at the same time, it's an excellent opportunity also together to overcome challenges. So I'm gonna highlight two important challenges. One, it's a regulatory and bureaucratic hurdle, because we know that healthcare, it's highly regulated industry. So for us, in order to be able to navigate in a compliance requirements with the different stakeholders, this could slow down the decision-making process and even slow down the partnership. So that's why government play an important role through streamlining the approval process, but at the same time, providing a dedicated PPP framework that would serve as a guidance for the key players to follow when they want to establish a partnership. So first, the regulatory and the bureaucratic hurdle. Second, which is something that we don't think of it, which is a misalignment with the goal and objective, right? So when we look at the public or the government, we know that their primary goal is to ensure that such kind of collaboration will have a positive public health impact, positive public outcome, right? And when we look at the private sector, they make sure that they are going to provide a public health impact, but at the same time, there are other considerations like financial stability, return on investment, and the predictability as well. So that's why it's very critical to bridge the gap between both entities to ensure the success. So it's a kind of like building incentive model that is linked directly to the healthcare priorities. This would, help to overcome such kind of challenges. But aligning on the goal, ensuring the transparency is a key for to overcome such kind of challenges.
Amazing. Thank you, Dr. Shereen. Actually, it's very interesting that we get the insight from both parties, what's the can fit provided. And this is my third question actually to Dr. Aseel, which is have both experience, I believe, that what do you, in your envisions of evolutions for the strategic, for expanding public-private partnerships, and what does the successful look like in your opinion?
Thank you, Dr. Anas. And to answer your question and to resonate with my colleagues in here, mainly the thing is that the first step is to have the right base and the right core for what is partnerships. So when we discuss public-private partnerships, we need to understand thoroughly what country are we operating in, not only as dynamics, also from the perspective of what is the national agenda and the strategic direction of each country. Once this is understood, we need to make sure that us as corporates, we do understand exactly what kind of deliverables, as what Shereen just mentioned, that we are eligible and we can commit forwards with. Once this is settled, the expansion model is going to be more clear by focusing on what are the most common key trends for the next decade or two, such as what Shereen now emphasized in her presentation, digitalization, AI, and these kind of forums. Because, for example, if we're going to discuss, for instance, digitalization and procurement, it's one of the main aims right now in the public sector, as it's going to support them with their modernization and their analytical efforts they're working on. Adding to that, making sure that these kind of models are aiming towards a win-win partnership model, and to ensure success is the sustainability of it. So we need to work in the mindset, whether it's corporate or also the public sector. It's not only an ad hoc or just to tick the box by mentioning we did the following agreement or we're just doing this partnership. It's more of ensuring the sustainability of these kind of projects and the agility of it, whether by planning or implementation.
Amazing, actually, Dr. Aseel, which is lead me to another questions. Could you elaborate on specific plans or models that you are aware to implement in the organizations and a systematical approach to be efficiently that?
For sure. So I'm going to discuss, like, for example, two models that we're having. The first one is in UAE. I'm sure that most of us have heard about the Life Sciences Hub strategy, which is, in a nutshell, it's more of a very clear pathway and a framework that the government of Abu Dhabi and the Department of Health have launched and established. So the idea behind it is to have a very clear, incentivized platform or framework where it comes with different models and priorities that the government of Abu Dhabi is having to be implemented. At the same time, they are actually complementing what capabilities each corporate can have. For example, it is systemized in a sense that there is a pillar for research, a pillar for having regional hubs in the country, a pillar of manufacturing sites, academia, and the list goes on. So what happens is, for me as a corporate, I'm going to go there, see what suits my strategy, what am I capable of implementing, and then we have a discussion, a clear one with the governments. This is where we're chipping in, and this is where we're collaborating, and voila, you end up having a win-win strategy. Another example is in Saudi Arabia, where His Highness Prince Mohammed bin Salman, he launched the 2030 vision of the PIF, the Public Investment Fund, which is mainly aiming on the diversification of the economy of Saudi Arabia. And by that, they had a major pillar of healthcare with lots of strategies and initiatives that we can, as corporates, implement. Based on these discussions and negotiations, we will end up having satisfactory initiatives both for the country and for the corporate models.
Very good, Dr. Aseel. Actually, yes, which is echo the same, that all the countries having the initiatives, partnership with all the authorities, with all the organizations, and it's matter what you are mentioning, it's to build your win-win situations.
Exactly.
So back in for you, Dr. Shereen, what are the key successful factors for building a trust between the government and the private sector for partnership in the healthcare collaboration?
Yeah, this is an excellent question. So trust is the foundation of any partnership, yeah? If we don't have a trust, even if we are having a very well-structured partnership model, without trust, we will fail. So how we can build a trust? Transparency and clarity in communication, it's a key. So each party should clearly communicate what is their goal, what is their commitment, and what is the performance expectation. And in order to have a kind of effective communication, there should be a kind of ongoing dialogue, right platform, that will allow the key players to share their thoughts and share their strategies and goal. This is number one. Number two, it's all about demonstrating how we are creating a real impact. Very important to remember, when we build any partnership, at the core of each partnership is the impact on patient and the impact on the community and society. So to grow such kind of trust, it's very important to have a governance framework that will allow each party to define what is their role, responsibilities, and what is the expected, outcome, and share it in an open way. It's all about, we need to demonstrate how we are creating an impact, share the progress, and make sure that such kind of a partnership, it should be dynamic and should be adapted with the evolution of the system as well. So if we have these key pillars, this will allow us, to build the right partnership that was built on a strong foundation, which is a trust.
Very good, actually, Dr. Shereen. Yeah, I believe yes, it's the same that currently there is implementations, let's say, for a new regulation. They share it with the pharmaceutical, what you think for, and they listening for the pharmaceutical feedback about the something that we need to amend it, to change it, to build, let's say, the real partnerships that achieving the win-win situations. That will lead us with Dr. Dr. Migdadi for one question that about what's the future trends to do in the shaping of the evolutions of the governmental and the private sectors partnerships and filled with medical procurement.
Okay. First of all, we have to invest more and more in data. Data, honestly, it is the backbone or this bloodstream of any successful supply chain. And on top of that, the data must be accurate, must be complete, and must be updated. And on top of that also, these different types of data must be shared in timely manner between different stakeholders, different partners, different functions, activities, and different managerial levels between all of these in the supply chain. So we have to invest more and more in data in order to get better result, in order to achieve the optimal goal, which is maintaining the availabilities of our products, quality assured products. This is first point. Second point, there is a need more investment also in digitalization, AI, the machine learning systems also, the Internet of Things, data analytics. All of these, just we are investing, we can overcome a lot of problems that we are facing in our supply chain. We will overcome the fluctuation in demands. We will overcoming a lot of different types of costs that will be added if we didn't overcome these challenges or didn't correct the procedures that must be done. Also, on top of that, we have to make a diversity of different types of suppliers, either the local manufacturer or finished products. Also, much more focus on the cost, and there are different types of costs associated with inventories, associated with healthcare service. It's not only related to direct or purchasing cost. We have to minimization of capital cost, storage cost, other types of costs associated with inventories. So much more focus must be on cost, how to optimize these different types of costs.
Thank you, Doctor. Actually, yes, I believe also the same that let's say the providing the data that everyone they know from the perspective that and investing in the right correct data about the demand, about the need, about that will build an easy forecasting for what we need to do, what we provide, and reducing the cost, providing, let's say, clarity of what we need in this next let's say tender, next bidding, next providing to ensure that availabilities and win-win situations for both. We thanks all the panelists today for discussions and they're joined with us, Dr. Shereen, Dr. Aseel, and Dr. Migdadi. Thank you for your time and this presentation.